everyone, and welcome to the Surgical Ergonomics Podcast, where we will be discussing everything related to surgical and procedural ergonomics, the people, ideas, and technology that will help enhance your physical wellness and career longevity. I am your host, Geeta Lal. I'm an academic endocrine surgeon, speaker, consultant, and surgical ergonomics coach. Having experienced work-related musculoskeletal injury myself, I am committed to increasing awareness of and developing solutions to counteract the impact of poor ergonomics on the professional and personal lives of healthcare workers in procedural areas. Today's episode is sponsored by Q Optics. Surgeons, your neck shouldn't pay the price for precision. It's time to demand loupes that are built for you. Q Optics is more than magnification. Custom crafted through the lens loupes engineered and tailored to your unique facial structure and surgical posture. The ultra lightweight titanium build eliminates pressure points, red marks, and the chronic neck and shoulder pain caused by heavy, bulky, outdated optics. With the exclusive TrueFit measurement system, each pair is precisely tailored to your unique facial structure, delivering a customized stress-free fit and all-day comfort. The Ergo Direct Vision loupes with up to 60 degrees of declination keep neck flexion under 15 degrees, or go zero flexion with the Ergo Angle Deflection loupes for a straight-ahead gaze and complete ergonomic relief. And with crisp edge-to-edge clarity within an expansive peripheral view around the telescopes, your field stays wide and unobstructed. Transform your OR experience today with a 45-day trial and exclusive pricing for listeners of this podcast. Visit qoptics.com/Dr. Lal to learn more and schedule your demo with a local representative. And again, don't forget to use the code Dr. Lal to claim your discount. Your work demands precision. Your body deserves relief. Q Optics, designed for comfort, built for performance. By the way, Q Optics has also provided us with an Ergo Angle Deflection loupes and headlight combo giveaway. The details will be provided at the end of this episode, so stay tuned. Hello, everyone, and welcome to another episode of the Surgical Ergonomics Podcast. In today's episode, I'm delighted to have as our guest Dr. Amanda Laird. Dr. Laird is a fellowship-trained endocrine surgeon, chief of the Section of Endocrine Surgery at Rutgers Cancer Institute, as well as professor of surgery at Rutgers Robert Wood Johnson Medical School. She serves on numerous committees for both the American Association of Endocrine Surgeons and the Association of Academic Surgery. Her clinical research has yielded numerous peer-reviewed publications, reviews, book chapters, and both national and international presentations. Hello, Amanda, and welcome to the podcast today.
Hi, thank you so much for having me. I really appreciate the opportunity to talk with you today.
Of course. So, Amanda, just to get us started, please tell our listeners a little bit about yourself, including maybe where you grew up, your training background, and how you arrived at your current role.
Okay, so I'm originally from Louisiana. I lived kind of all over the state. I was born in New Orleans, and then when I was 11 and a half, we moved to Northwest Louisiana to Shreveport, which is where all of my family still is. I went to college at LSU and medical school at LSU, Louisiana State University. And then I left for my general surgery residency in 2000. So I trained in general surgery at Wake Forest. And I initially took a private practice job in general surgery out of residency training and decided a couple years into practice to go back and pursue fellowship training. And so I spent 5 years in private practice and then went to the University of Michigan and did my endocrine surgery fellowship. After that, I moved here to the Northeast. I worked first at Montefiore Einstein, which is in the Bronx. And now I'm at Rutgers here in New Brunswick, New Jersey.
Great. Thank you so much for sharing that. So it just goes to show, you can always have a change of course. Just because you went into private practice didn't mean you couldn't come back and, do a fellowship, right?
Right. Well, it's pertinent to to the subject matter here, I have
Oh,
a whole different set of injuries from endocrine surgery compared to my time doing general surgery. So the most common things I would do on call would be laparoscopic appendectomies, laparoscopic cholecystectomies, and as you've talked here before, the instruments are so big, they're hard to use. And I wear a 6.5 glove. So after a really busy weekend of call, if I had done, let's say like 15 operations, I go into my regular work week, which was probably another 15 operations. The intermetacarpal phalangeal ligaments on my finger, they would just be swelling. So in between operations, I would tape my fingers and ice my hand.
oh my.
Now it's my neck. I've had problems with my elbows, my shoulder, my back. So with endocrine surgery, probably the biggest change is that it's not as much my hands anymore, but it's my neck.
I see. Thank you for sharing that, Amanda. Appreciate it. I do want to point out for our listeners that, there's actually some published data on endocrine surgery and work-related musculoskeletal injuries, the ones you kind of pointed out. And one of our residents in otolaryngology, Megan Jensen, she's since graduated. She and I did this study a couple of years ago with Dr. Sugg as well as Dr. Pagadar, colleagues at the University of Iowa. And we surveyed AES members as well as members of AAHNS, the endocrine section. And no surprise to us, but the numbers are still mind-boggling. 90% of the surgeons doing kind of endocrine surgery reported MSK symptoms, and the common locations were neck and shoulders. No surprise to those of us who do this kind of surgery. But also, another kind of piece of information that came out from that survey was that, women were more likely to be symptomatic, just like if you look at the literature in any specialty now, you'll see that women are going to report, a higher rate of symptoms and injury. And one of them has to do with what you described earlier relating to laparoscopic instruments. Obviously, there are many other, reasons, but that's certainly one of them. The instrumentation isn't designed for those of us who are kind of at the extremes of hand anthropometrics, if you will. For our listeners, I got to know a little bit about Dr. Laird's journey when I visited Rutgers last fall to do kind of a grand rounds presentation as visiting professor on surgical ergonomics. And so we often talk about how there are, those of us who spend an entire career in surgery and don't get any injuries or don't have any pain. But I think those numbers, when you look at them, those people are in the minority. The rest of us have symptoms to varying degrees. And so I was wondering if you could share kind of your entire ergonomics journey with our listeners. You mentioned kind of briefly what happened during the course of your endocrine surgery practice. So if you could elaborate now how long you've been doing endocrine surgery and what your sort of specific journey has been like, and what have you learned during this journey, I should say.
So I've been doing endocrine surgery for 15 years. My first orthopedic operation was when I was a resident. I had carpal tunnel. I have a couple of risk factors for it because I have hypothyroidism and I'm a woman. So I don't know that necessarily that was a work-related issue, but I had surgery on my left hand 1 year and then my right hand. Then after, let's see, I finished my fellowship in 2011, and after a few years, I got the equivalent of tennis elbow, that I jokingly referred to as thyroid elbow, because anybody that does thyroid surgery knows that you put your hand in this really rigid position to retract the thyroid so that you can expose the recurrent laryngeal nerve to be able to do the operation. And if it's a really big goiter, sometimes that takes quite a bit of effort. And so that pulling motion contributed to the development of tendonitis, lateral epicondylitis in both elbows. And so, of course, I did what all doctors do, right? I went to one of my colleagues, one of the orthopedic surgeons, and I say, hey, my elbows are killing me. I neglected to take the time to take care of myself. And finally, I had to have tendon releases on both of them. It was about 2 years apart. But I failed physical therapy, conservative therapy, medical management with the steroid injections, et cetera. I left my job at Montefiore. I was recruited to Rutgers 8 years ago.
Mm-hmm.
And for anybody that's had a career shift, you know that when you leave one practice and go to a new one, there's always this little bit of downtime because you're trying to rebuild your patient base. And I had a couple things going on. One was that I'd had terrible hip pain, and it was likely exacerbated by running. I used to run for exercise, and it turned out that I had labral tears in both my hips.
Mm.
I had surgery on both. I had the left one redone, and it's been 2 years now. I finally had to have my left hip replaced. And just for so everybody knows, I'm 51. So not old. I
Mm-hmm.
I
Mm-hmm.
think not old. The other thing that started going on around that time is I started getting terrible migraine headaches. I was diagnosed with having cervicogenic migraines from facet arthropathy. That was probably about the time I started asking the question, why on earth am I getting all these injuries?
Mm-hmm.
Since then, I've had been diagnosed with facet arthropathy in my lumbar spine. I had a lumbar disc herniation that I had to have surgery for. And what else? I think that I think that's it, because the last thing was my hip, although I have to have my right hip replaced now. But I started asking the question, why is all this stuff happening? And then 2020 happened, and we weren't really doing as much clinical work. And I finally had some time to really think about it and ask the question.
Right.
So I sought out help from one of my rheumatology colleagues,
Uh-huh.
and I was diagnosed with having joint hypermobility syndrome, which is, I think, also synonymously called Ehlers-Danlos type 3. And
Mm-hmm.
I never, no, I did finally have formal genetic testing. I had a variant of undetermined significance, but at least for me, it was a way to understand why all these things were happening and
Mm-hmm.
why I might be at greater risk for injury. And the one piece I'm still working on is what can I do to mitigate the effects of my professional life on my joint health.
Right, right. Wow, Amanda, that is a lot for anyone at any age, let alone, as you said, and no way, I mean, early 50s is in no way old. I should know I'm there too. So
Yes.
my definition of old keeps changing, of course, the older I get, and I imagine it's similar for most of us.
Yes.
But that is a lot of injuries. And, your journey highlights a few things that I want to kind of point out for our listeners. Number one, we're so driven and so focused on providing patient care and the work we do on a day in and day out basis that this has come up on multiple episodes that we tend to kind of ignore our symptoms when they're initial and nagging. Like we're not good at heeding our check engine light, if it were, right? We have to have things break down before we will actually try to go figure out what needs to be done. And so, what I'm trying to say is you're not alone in that sentiment. And I don't think you or anyone else experiencing work related injury has to feel guilty that, well, I did what I do, which is I don't take care of myself. It's a bit more complicated and nuanced than that. You want to take care of yourself, but then you have all these other obligations that outweigh maybe finding some time that you need to take care of yourself until your body forces you to. It was the same with me. It's the same with many other guests we've had on the podcast. And so I just want to let our listeners know that, that's a common response. The important thing to realize is that you're not alone, right? And surgical ergonomics related work related injury is not something that is very rare. In fact, we're finding out it's quite common. It's just not talked about or reported as much. And I'm just glad that we're having these conversations. The other thing is, obviously, it took so many injuries and maybe a pause in our healthcare world for you to kind of try to even put these things together, right? And then being able to find other physicians who could think with you and figure out what might be going on and get the additional testing and things like that, right? I'm thinking it was somewhat of a relief to think that, to realize that, this is a combination of nature and nurture, not something that you were alone responsible for. Am I correct?
Yeah, absolutely. Anybody that has, tends towards curiosity, or,
Yeah.
we're also scientists. And so, my scientific brain is trying to figure out, what is the root cause of all this? Like what are the contributing factors? What are the things that I can control, and what are the things that I cannot?
Right.
And taking care of my own health, and the reticence to do so is so multifactorial. I think that in surgery, especially women in surgery who maybe started their training in years past, I predated work hour restrictions.
Me too.
Yeah, I always felt, whether it was true or not, that I had to do better than my male colleagues. And certainly I wasn't going to complain about having aches and pains, or, anything like that, because I didn't want to be seen as weak or lesser than. And I mean, I think not even just because of that, that's carried over, right? Surgeons are supposed to be tough,
Invincible almost.
right.
Hmm.
And it's taken a long time to finally realize that I'm really not doing my best work as a surgeon if I don't feel well. And
Right.
it's a constant inner struggle to identify the times where I can really take care of myself and block my schedule out accordingly. And sometimes
Hmm.
it's a wait. So, for example, I need to have my right hip replaced now, but I'm not going to do it probably until like January or February, because it's enough time where my schedule sort of cleared out, and I know it's not going to be too disruptive. Um,
Right. Right.
but the hard thing is that, there ends up being, I have a wonderful partner here, whose name is Dr. Tony Beninato, and she will take care of everything when I'm on leave. But there's just this guilt associated with stepping back from practice. And I think one of the things that I've learned getting older is that it's really okay and 100% necessary to take this time for myself, because I can't be my best self if I don't feel well. I used to check my email constantly on vacation. I don't look at it at all now. And I don't
Mhm.
open up the medical record to check on things while I'm away. I just have to have faith that it's all being taken care of.
Right.
The other thing I'll say about taking time off to take
Hmm.
care of myself is that, I don't know, and this may be a little bit touchy, and certainly everybody's employer is different. Sometimes there it feels like there are some unrealistic expectations with respect to the amount of clinical work that we do.
Hmm.
Understanding that medicine, in addition to being a profession where we take care of people, it's also a business. It's hard to cope with having some limitations and feeling like I need to take the time away to take care of those. So there's this struggle between,
Hmm.
is now the right time for me to take time off to take care of myself, or,
Hmm.
should I just delay it and put it off? And what's going to make it worse, right? Because I may be less productive if I feel terrible. Uh,
Right.
I'm going to be less productive if I take time off. And so there's this constant, like, trying to figure out what the balance is. And for those of us that practice medicine, either most people's practices are full enough that somebody else can't take over what you're doing, or we've gotten ourselves into a place where we're really subspecialized, and maybe
Hmm.
one of a couple of people in your region that do what you do. And so it's not easy to just step away and say, okay, somebody else will take care of it. At the heart of that, I want to meet the expectations of my patients and take the best care of them that I can.
Well said. And thank you so much for sharing these insights that came along with the difficult journey that you've had. What I'm realizing is that you're echoing something I hear very often, right? There are these multifaceted reasons for where we're not so good about our check engine lights and getting things done, because it's the expectations that society and our workspaces place on us that our patients have of us, and then most importantly, the weight of the expectations that we put on ourselves, right? I had the same sort of similar conversation with Sarah Temkin a few episodes ago, where we talked about how, like, I felt being kind of the first resident of Indian origin in my surgical training program in a very diverse place like Toronto, but this is 30 years ago. And constantly that pressure to feel to be your best and be better than everyone else was, well, if I don't make it through, or if something I do becomes a disaster, then they're never going to let another woman of Indian origin in. So, and again, I realized that that was me. That was maybe not necessarily from the external, but it's very similar to what you so eloquently described in these last few minutes. And that's why it makes it harder. And that's why the things that you have said, I can only bring my best self and be my best self to take care of other people if I am feeling my best self. And that, I think, is an important takeaway for listeners of this podcast at any level, but especially our trainees, right? Who
Right.
feel that additional pressure on top of everything else, that they're in a training program, they have a finite amount of time. um, Guilt taking time away. What does it say about me? What does it, is my, are my partners going to be able to do this? They are going to be able to do it, but what are they going to think of me? Are they going to think I'm a slacker? All these feelings, the stigma, the shame, all of it makes a difficult situation seem even harder. So I think talking about these things and having peers and mentors that you can talk to about this. And I know that, I think Dr. Laird would be very open if other people are going through these struggles and would like to speak to someone about navigating this journey, then you'd be open to them reaching out. So
Absolutely.
yeah. So we'll include Dr. Laird's sort of contact information on LinkedIn, as part of the show notes. So let's continue this conversation and take it a step further. So, um, you know, we all practice in different systems. How did you end up approaching when you realized that you needed this surgery, and maybe sometimes the surgery, one of them needed to be redone? When we're in the middle of things, health crises, be it work-related, musculoskeletal issues or any other health crises, we're thinking about our patients, we're thinking about our partners. How can people navigate sort of the healthcare system as patients and as surgeons, you know, sick leave, FMLA? Where do they start if they're facing these issues? Do they go to their HR rep? How does this work?
Well, I suspect it probably works differently everywhere.
Hmm.
And because I'm employed through the university, it's probably easier than it is for those that are employed via the healthcare system, because the
Hmm.
HR departments are different, the benefits are different, et cetera. So we have an excellent sick leave policy. Unused days carry over almost indefinitely. And I have a really fantastic division chief who understands and knows that between myself and Dr. Beninato, we're gonna take care of our patients, and you're not gonna notice that I took some time off. But I suspect it's different everywhere.
Right,
And so
right.
I think that you just have to check out what what would be the HR requirements, and probably talking to your immediate report is the best thing to do. They should have at least a grasp on what the next steps are. The one other thing I'll say is, my problems have gotten pretty complex, and
Hmm. Hmm.
none of them, fortunately, are life-threatening, but they're very life-altering.
Right.
And I cannot tell you how many times, over sorting this stuff out for myself, that I have said to myself, I'm so glad that I'm a doctor, and because I've needed surgery, that I'm a surgeon,
Hmm.
because
Hmm.
I speak the language and I have different contacts, and I
Right.
understand the way that the healthcare system works. And it's hard for me. I can't imagine. I've done this for so long, I can't put myself in the place of a layperson, but I really feel for our patients trying to navigate through this healthcare system. And even though this isn't precisely what you asked, I will say that, having had all these operations myself,
Hmm. Hmm.
especially I've had 3 operations on the same hip, it's given me a lot more insight into what it's like to be a surgical patient, and what it's like when things don't go right the first time. Um,
Right.
and and I don't mean that to, I don't place blame on any of the surgeons that operated on me. That's not what I mean by that. But,
Mm.
not everything works perfectly the first time. Sometimes we do this and we anticipate, the outcome is this and it might get better, or, you might go on and need to have a joint replacement. But yeah, I don't know how, if you have no medical background, how you navigate the healthcare system. That's probably a whole separate topic, but I am fortunate for at least having the knowledge I do and having to navigate all of this myself. But back to the original point, it's always, I would say that you need to go to your direct boss, and then they will probably be able to put you in touch with the right person from there. My only other piece of advice is this: if you can, it's ideal to try to plan in advance. Not everybody has the luxury of doing that, because
Sure.
either you have a problem that requires some more urgent treatment, or you have an unexpected illness. Start with your boss, and I have a great one. He's very, very empathetic and understanding.
Okay. All excellent points for our listeners as well. And I appreciate you kind of sharing, these personal insights. I know it's not easy, and so thank you. I guess now comes, I guess what I'm thinking is, so you've had these various injuries over the years, and you now find out that you have kind of an underlying issue that probably predisposes you to the injuries. How do you move forward from all of this knowledge and information and procedures? How have you maybe adapted your practice or the kinds of cases you do? If you've had to adapt them, I was wondering if you would be willing to share kind of the ongoing practice
Yeah. So
challenges.
I'm still trying to really sort out for myself what that looks like, because
I see.
I'm pretty stubborn.
That is synonymous with being a surgeon. I mean,
Um,
that I think stubborn picks the specialty.
yeah, exactly. And so I don't always do, I don't always do the right things I need to do to take care of myself. Usually on a regular ORD, I do 5 operations. And
Okay.
I'm focused on doing them and getting them done, because once the day is over, I can unwind and put ice on whatever hurts.
Mm-hmm.
The one thing that I have adapted is, most of us that operate with trainees and do thyroid surgery, for example, stand opposite of the lesion side. I had to stop doing that because I cannot lean my neck all the way over and have my neck bend forward that much. I have an anterior listhesis and arthritis, and so I just can't do it. So I've apologized to the residents in advance and tell them, if you think that this is affecting your learning experience, then you can take advantage of another opportunity. But they've all been, I think, relatively understanding.
Mm-hmm.
Aside from that, I haven't been very successful in making many adaptations. I do stand on a gel mat, which I think I
Okay.
told you before, I call my Empress pad. Um,
Yeah, we had that discussion when I was at Rutgers, right? The Empress pad.
right. And they even have my name on it. I ice my neck and shoulder between operations. I work with a wonderful OR team. I'm
Mm.
fortunate most of the time I get to work with the same group of people, and the nurses will go get me ice between operations.
Wow, amazing.
Yeah, they are truly fantastic humans. And anyway, those things do make the day better, because having some consistency with those people whom you work really, really helps, because it takes one less layer of stress out of the day. So I didn't specifically ask for that because of my orthopedic injuries, but because I do a high volume of surgery. I mean, getting through turning a room over 4 times is not easy.
Mm-hmm.
um, I talked to our OR leadership and impressed upon them the importance of working with the same team, and indirectly, I think that's helped my physical well-being,
Right, right.
in addition to my mental well-being. And I think that we've probably shown that we have a very efficient practice. And so, yeah, those are the few modifications that I've done. But aside from that, I haven't really figured out that answer, because I don't think that the work that I do really is extrapolatable to using technology like robots, which has been something that's impacted ergonomics and other fields. I do about 25 or to 30-ish laparoscopic adrenalectomies a year, and
Mm-hmm. Mm-hmm.
I would meet the minimum requirements to maintain robotic surgery privileges. And to be honest, 30 out of 300
Mm-hmm.
isn't going to be the thing that tips me over the edge with respect to my joint health.
Mm-hmm. Mm-hmm.
Um, and it's hard to sort out how to fix the other things with thyroid and parathyroid surgery, but I do find myself trying to adjust my posture, stand up straight, do some stretches in between operations, and ice.
Yeah, yeah.
Ice, my friend.
Thank you for sharing those. And they're all kind of in line with ergonomics recommendations, that the American College of Surgeons puts out and that the Society of Surgical Ergonomics has on their website as well. All the key things you said, like how can you best set up, position the patient and yourself for the surgery. So you pay attention to that even before you make the incision, right? So standing on anti-fatigue mats, realizing which position is better for you from the side, side of the pathology rather than opposite to the side of the pathology. And I completely understand. I think those of us that work from the opposite side of the table have a higher incidence of issues with the neck because you really have to then lean over, right? You hit upon a really important point. The importance of the same team in terms of patient outcomes has been shown again and again in various types of surgeries, but the importance of that for making things efficient and helping what we call our cognitive ergonomics. Obviously, your team helps your physical ergonomics and from the whole efficiency standpoint, as you pointed out, but it also helps to have the same people. It helps your cognitive ergonomics. You know what you need is going to be there. It's not like you're going to have to ask for something and they're going to have to run. And then you're wondering, how much longer am I going to be under anesthesia, have my patient under anesthesia
Right.
while somebody finds something. All those things add up because the mental stress and the mental tension then reflects in the body. And, if you already have chronic issues, then it just worsens the situation. I have to commend you for your commitment and for all the things that you're doing to continue to work, at your job, because that's a lot of investment on a daily basis in between cases, etc., to make sure that you can kind of get through your day. For our listeners, I will say that, there is some data to, people have tried positioning and set up for thyroid surgery, in many different ways. Some people have looked at using the operating microscope because then it has a headlight and a built-in magnification, because one of the key contributing factors for us for neck issues is our loops and our headlights, right? So that's something to look into. And, as Dr. Laird has pointed out, robotic surgery is potentially an option, but I don't think it has been FDA approved for thyroid surgery for quite some time. The last time it was, I think, in 2010, 2011. Beyond that, it hasn't, for a whole host of other reasons, which are beyond the scope of this podcast. You mentioned the adrenalectomies, and I think I've seen or at least talked to a few surgeons who have shifted, like you said, to doing them robotically just so you can sit. But again, you can sit and the console is adjustable, but again, it's not completely free of ergonomic issues. And so taking those breaks and postural resets, those things have to continue even if you're doing, robotic surgery, because it can bring different challenges. So all these things are important, to remember. For me, one of the biggest changes I made, Amanda, was to enlarge my incisions. I used to be able, I started, when I started, I did parathyroids through 4 centimeter incision, thyroidectomies through 5 or 6 centimeter incisions. And my neck and shoulder issues, trapezius, are all left-sided, and it's plain from retracting, right? Because the smaller the incision, the harder you have to retract. It's definitely a contributing factor for my particular symptoms. And so once I realized that, it made a huge difference to just enlarge the incisions and maybe divide the deep straps superiorly a bit more frequently so that I don't have to retract as hard. And I talk about this in every talk that I give, that you can adapt what you do. Other surgeons will try to mix up the cases. So you might do a thyroid and a parathyroid and then an adrenal all in the same day, so that you're not doing 3 neck or 3 to 5 neck to neck, neck cases back to back, I should say, not neck to neck. So all these things can kind of, and thinking about these things can, help enhance one's career longevity. I'm always amazed how quickly these conversations go. And, in the last few minutes, I was wondering if you could share, some advice that you have for the trainees that you're now training, or up and coming surgeons in any field, but maybe even endocrine surgery. things that they should be aware of and should be thinking about that you've learned from your journey and from others' journeys?
I try to talk to them about it pretty openly.
I see.
If I don't do that in the operating room, at the end of the operating day, we have a Starbucks and, as you know, in our hospital atrium.
Yes, I have visited
Yes.
that. Yes.
So I take them to Starbucks and I have what I refer to as coffee talk.
Hmm.
In the Northeast, there's so much traffic that if I lived around the corner, I might
Sure.
just go home. But for anybody that does neck operations, that
Yeah.
a hematoma in the neck means a trip right back to the operating room. So I always stay for a couple hours at least.
Hmm.
Honestly, I
Hmm.
usually have stuff to do anyway.
Right.
But I started using that time to take the residents for quote unquote coffee talk. And I tell them we can talk about the day, we can talk about anything else. I can talk to you about why I stand on the same side of the table as the the side of the thyroid that we're operating on and how I got here. And I've tried to share tidbits of how I take care of my physical health and how you can do those things proactively to make sure that your career is as long as you want it to be.
Right.
And sometimes we just chit chat, but and they
Yeah.
work hard, so they deserve something nice at the end of the day. They also have the option to not talk to me at all, so I'm not forcing them to.
The coffee is
Uh,
not contingent upon like having a conversation. Got
no, no,
it.
no, no, no. They can also just have a hot coffee and go do something else. But anyway, I try to share my experiences with them
Yeah.
openly because eh, from when I was in training, there was one woman who was also in the residency with me, and it was hard to see people that were or find mentorship from people that were like me.
Hmm. Hmm.
And it's always easier to talk to people in whom you can see some of yourself, I think. And even if I'm not that right person for our trainees, then I'd like them to know that I can empathize with them and certainly point them in the right direction. And if nothing else, I'm here to understand and support them.
You're open and available and a safe space because you are talking openly about your journey, then it makes you a very safe space for them to bring up their concerns, which is a huge service. So thank you for doing that. I appreciate your time today in sharing all of this. And I think from the last bit, what I took away is I think the next time we're at the American Association of Endocrine Surgeons leadership meeting, we should probably talk about having curricula for the fellows, right? Because we have all these fellowships that we're crediting, and we could probably pool our individual and collective wisdom regarding the ergonomics of our subspecialty that we've learned over the years and ensure that it becomes kind of part of that education, just like now we're kind of looking at ergonomics curricula, and several institutions and hospital systems are trying to have kind of ergonomics workshops for their residents and things like that. We also need to take that kind of to the fellowship level.
The one other thing that I would really love to see change
Yeah,
in healthcare, especially for surgeons and proceduralists, I mean, honestly, really anybody, because if you sit at a computer all day,
exactly. Yeah.
you're like, oh, this all the time, is that as a group of people who take care of people, we are really bad at recognizing that we need to take care of ourselves.
Hmm.
And for hospital leadership or department leadership, I would love to see administration or department leadership champion an effort to maintain the physical health of doctors, and whether that's having occupational therapists and physical therapists come around to workspaces to, adjust. Listen, if somebody could come like adjust me like between every
Right,
operation,
right.
it would be a wonderful day. But when you think about the differences in the resources that say a professional athlete has versus what we have,
Yeah,
I mean, we have nothing compared to that.
yeah. So anything is an improvement, right? Yeah.
Anything would be an improvement, but I would love to see that be a change that gets adopted into healthcare organizations or in medical practices, because if we don't take care of ourselves, then we're not going to be available to our patients in the best way.
Agreed, 110% endorse. As I say often, it's one of my missions to have a massage therapist embedded in every department of surgery across the country. So, we can band together on that. So, Amanda, with that, again, a deep sense of gratitude to you for one, sharing your journey and story with our listeners today, and two, for being the advocate that you are with regards to sort of general physician well-being and particularly physical health. And thank you so much again for your time today from your very busy schedule. Our listeners and I appreciate it very much.
No, I thank you for the opportunity and for the invitation, and I'm happy for anybody to reach out to me if you need guidance or just somebody to listen.
Thank you so much. I'm sure that will be much appreciated as well.
Thank you.
Please remember to subscribe to the podcast and follow us on social media, Instagram, X, Facebook, and LinkedIn. We love feedback, so please reach out to us for topics, ideas, speakers, or if you ever want to be a guest on the show. Thank you for listening. To enter your name for the Ergo Angle Deflection Loops and Headlight Combo giveaway, please go to our podcast landing page at www.surgicalergonomics.com/podcast/ and fill out the contact form at the bottom of the page. Choose Other in the drop-down menu and indicate Loops giveaway in the message. We will do a drawing for the winner in December of 2025, so please spread the word among your colleagues and friends who might be in the market for new loops. Thank you.